Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase how communities are taking on coronavirus. We also break down the major headlines. Today, a new economic estimate. Experts see the coronavirus having a long-term impact on the U.S. economy. The Congressional Budget Office projects the nominal gross domestic product, or GDP, will be $15.7 trillion lower over the next 10 years because of the pandemic. That's compared to its 10-year projection from back in January. Certain blood proteins could predict severe cases of coronavirus. Scientists found 27 proteins that appeared in low levels in people with mild cases and high levels in people with severe symptoms. Scientists hope to use this discovery to develop a test to predict who might get critically ill. The World Health Organization says the pandemic could allow superbugs to get stronger and more common. It says as people take antibiotics to treat coronavirus, which aren't proven to work, bacteria can build up resistance to those drugs. When that happens, common meds stop working. The WHO says not to use antibiotics if you don't have to, and not to overuse them if you do. A nonprofit is paying off tens of thousands of dollars in medical debt for frontline medical workers. Alexa Liaco spoke with a nurse who says this act of kindness has changed her life.
It was literally thousands of dollars that I went into debt.
Nurse and mother of two, Vanessa Matos, had a surgery nearly 10 years ago.
A surgery that I had many complications.
She was in and out of the hospital several times over the next 5 years, and even with insurance,
they had to send me out to a different hospital in Boston. None of that is covered.
For years, she's been working to pay off the thousands of dollars in medical debt, some of it from the very hospital she worked at.
I can't say you feel shame. It was like, oh my God, I do, so much. I go to make sure all my bills are paid in time.
With student loans, mortgage payments, and young children, her medical debt became a constant burden.
Getting those letters and those calls, it's humiliating and it's very stressful.
The pandemic only making the stress worse as Matos found herself on the front lines, at high risk for infection and another hospital bill.
To be carrying that burden, especially when you think, oh, what if I treat a COVID patient? What if I catch it? Because I know how much one trip to the ED can cost.
But she received a letter just a few weeks ago, a message of relief from a nonprofit called RIP Medical Debt. Her remaining medical debt was paid in full.
It was very overwhelming, and I was very grateful. Thinking, wow, this is really good. That is a blessing for sure.
Craig Antico, CEO of the organization, says the company buys medical debt from hospitals at a fraction of the cost, all through donations.
We're able to buy about $100 for every $1 of donations, so it's pretty impactful.
The company created a Helping COVID Heroes Fund to buy debt specifically for first responders like Vanessa.
And we're going to wipe that out first. The second tier of people that we're going to wipe out for are all these occupations, these people that are just being hard hit and are out of work.
Donors can choose anywhere in the country they want to help.
We're trying to right a wrong, an injustice that's happening to these people. Not only are they ill, but they're then add insult to injury. They're in debt for it.
With Matos' medical debt wiped clean, she can now go back to school. The random act of generosity bringing her opportunity and a renewed sense of hope.
When you always hear is bad news one after the other, it's good to know that there are good things still happening and the human beings are being kind to each other.
I'm Alexa Liaco reporting.
There are still many unanswered questions surrounding how COVID-19 affects children. Doctors in Colorado are digging for more information through a new study. Right now, it's believed that children are less likely to become infected, but it's not known why. One thing the study at National Jewish Health will look at is whether children are less likely to be infected or whether they're less likely to develop a respiratory illness, even if they are infected.
With most respiratory viruses, we know that children that are asthmatic or have allergic conditions have a much stronger reaction to infection, and a lot of times that causes exacerbation of their disease, even causing hospitalization of these kids.
The study will also look at how eczema may play a role in symptoms and the severity of COVID-19. Some people with asthma are finding unexpected help fighting off coronavirus. Doctors say they've noticed the immune response that drives asthma also seems to turn off certain immune cells the coronavirus uses to infect and spread. One doctor thinks certain additives in asthma medicines, like enhanced steroids, also help those who use them.
In fact, the proportion of patients who have asthma that are getting significant respiratory impact from the COVID-19 is much lower than what was predicted. I think that it's important to be on your medications, especially your asthma medicines, so that your asthma is well controlled in the event that you get the COVID-19 infection.
Dr. Hogan says allergies also trigger a unique immune response and that allergy medicines could also help in fighting COVID-19. Doctors say taking allergy and asthma medications won't help at all unless you have allergies and or asthma. A nonprofit that helps teens learn life and leadership skills isn't letting coronavirus derail its mission. Kristen Burns shows us how one internship program in Wisconsin has adapted.
When there was no such thing as COVID-19, these Milwaukee students spent a lot of time team building, working in groups and gardens throughout the city, all while making $8.50 an hour.
I didn't even know how to plant. I didn't know how to garden or nothing. It was fun, and seeing it grow was just, I loved it because I actually grew the plant.
14-year-old Markel Milton is one of 48 Milwaukee teenagers doing an internship at Teens Grow Greens this year. While so many companies are cutting back, this nonprofit is welcoming students on the South Side to sign up.
We saw it as really essential to continuing the internship and serving our mission, albeit from a slightly different path. Executive Director Charles Eline says his nonprofit would never quit on these kids, not even during a global health crisis. We've had to adapt that this year. We're now going to work in 10 different gardens across the city, and the teens are going to be working in small groups. And gardening had to go virtual. Students now do healthy living lectures on Zoom and watch live cooking demos. Markel Milton is anything but bored.
I still love doing the online stuff. We still get to learn about planting and learn about other people, how they experience with growing plants and eating healthy foods.
The teens also take home seed kits.
Gardening has a wonderful effect. You are in the moment while you're gardening. You have your hands in the dirt, which is very therapeutic. You are able to grow your own healthy food and then share that with your family.
The group's mission is to make every teenager become a purposeful leader in their own life and the lives of others. Well, pet groomers are busier than ever as things start to reopen. How a normal trip has changed and the extra fee you may see on the bill. And the technology helping musicians make songs during the pandemic. The dog days of summer are starting. After being shut down for months, some states are now allowing pet groomers to reopen. Some owners told Kai Beach business is busier than ever.
If you want to get your dog's nails trimmed or haircut, get in line.
Things happen, yeah.
Because you may have to wait a while.
We're backed up about 1,000 dogs.
Brad Taylor owns Urban Dog, a pet supply and grooming shop.
On June 16th, and I have you booked with Crystal at the Uptown store.
Because his business wasn't considered essential, Taylor had to close his doors for 7 weeks.
What kind of dog?
Forcing him to furlough 80% of his staff.
It was hard. We were very concerned about our staff. It's taken a long time to assemble the grooming and retail staff that we have here.
Now with the restrictions lifted, Urban Dog is back in business just in time for shakedown season.
I wish I would have been the first person to call because I had to wait another 2 weeks to get in.
Sarah says she hasn't groomed her dog Scotch since COVID-19 concerns hit in mid-March. A timeline Taylor says could have caused major health hazards.
We had situations where we had dogs' nails that were growing into their pads. We had dogs that were severely matted and struggled to perform bodily functions properly.
With many dogs requiring extra attention, Taylor has now added a $10 recovery condition surcharge.
So this extra charge here is the amount we're taking extra time on each dog. There's a lot more matting that takes more time to remove. It also helps our groomers.
And there's been such an increase in demand for these services that Urban Dog is now looking to add extra groomers. As workers, well, they can make a whole lot of money.
Full-time groomers make anywhere between $55,000 and $90,000 a year.
Taylor calls dog grooming an important trade. While many customers are happy to just get their dogs cleaned up.
I'm really glad to get back and be able to give my business, and my dog feels a lot better. He's happy to be back.
Urban Dog is working to get caught up and hopefully serve everyone by the end of June. I'm Kai Beach reporting.
People are spending more time sitting, often in front of screens, since the pandemic started. It's not entirely surprising with widespread stay-at-home orders and business closures, but even before the pandemic, only about a quarter of Americans got enough exercise, according to federal data. Cambridge Open Engage found the average person in the U.S. has reduced their physical activity by 32% since social distancing started. Summer break is here, but it may not be all that different since students have been at home for a couple of months now. So how do we make that transition to summer break? Well, mental health experts say families can begin by checking in with one another.
And maybe we were checking in with our kids in the beginning to see how they are, and we've just gotten used to this new pattern, and we've forgotten to say, like, hey, how are you doing? But that is so important. They're not going to tell us if we don't first calm their fears.
If your kids have a lot of pent-up energy right now, that's understandable. One way to get everyone on the same level is getting together a set of activities. As a family, you should write a list of activities and a list of things that make you happy. Making the list will make you more likely to get those activities done. Experts say it's important to talk together as families. That can be done through having scheduled meal times. Well, cities are preparing for more people to go back to riding public transit. The big issue, how to keep riders and drivers safe. Our partners at Newsy and reporter Patrick Terpstra look at how cities are trying to keep buses clean.
This is real, and y'all need to take this serious.
At the beginning of the outbreak, Detroit bus driver Jason Hargrove warned of COVID-19's threat to public transit.
There's folks dying out here.
In the 2 months since he himself died from the virus, Detroit and other cities transformed the bus experience, providing masks for drivers, requiring them for passengers. Boarding is in the back now and free to keep riders away from bus operators. Still, 25 drivers in Detroit are positive right now with coronavirus. Hargrove remains the only death. His best friend and fellow driver, Eric Colts, told Congress last week the city bus is still a dangerous place to be.
Because you still have people that are actually either coming out with no mask or they're just out riding the bus because it's just free.
Cities are struggling to create a safe environment on public transit as they prepare for the return of commuters and other riders. In Detroit, Colts says masks now given to passengers sometimes run out.
We have a box of 50 masks that by the time I do a round trip, those masks are gone.
Denver is working to overcome supply chain shortages to get hand sanitizer for passengers. And New York City is testing ultraviolet light to kill the virus on subway and bus handrails, an imperfect solution.
Over the course of the day, it will steadily get contaminated again.
Whenever New York reopens, officials concede 6 feet of social distancing will be impossible at times on the MTA, the largest public transit system in the country.
Cities tell us another big challenge is figuring out exactly how many people are going to ride the bus again, especially because instead of being able to pack on board buses with some people standing, cities are capping the number of riders at 20 for social distancing.
A survey earlier this month by Mass Inc. polling group found a third of Boston area residents said they would ride transit less often than before the pandemic. I'm Patrick Terpstra reporting.
Technology is helping musicians who have been struggling to create while under stay-at-home orders. A San Diego State University professor has been working on an audio production library and plugin for a decade. He recently made it available to musicians after he started getting requests.
We were able to take the sounds from around North America, a bunch of fascinating acoustic spaces, and make reverberators out of them so people can virtually perform in these spaces.
Now musicians can access and use clips from unique places. Listen to how a flute played in the living room sounds in an Alaskan tunnel and a racquetball court. Musicians say it's a crucial tool for making music at home. The software is free for anyone to download and use. A new effort is helping restaurant workers keep their jobs and get meals to first responders.
We're really excited about giving people some source of income through this pandemic.
How this partnership is working and where organizers hope it goes from here.
CERF.org.
Welcome back. The idea sounds genius, a way for restaurant workers to keep their jobs and at the same time help get first responders meals. Maya Rodriguez shows us the brainchild of one nonprofit whose model is keeping paychecks coming from coast to coast.
Inside Emily's restaurant, the tables may be empty, but the kitchen is cooking.
You can call it global, you can call it fusion.
For Chef Kevin Tien and his staff, there's an order for 100 Vietnamese rice bowl lunches on this day, heading to the staff at a local Washington, D.C. area hospital.
Jasmine rice on the bottom, lemongrass grilled chicken.
But how the order came in is far from traditional.
We saw this huge need on both sides.
Ariana Tiwari is with Off Their Plate. It's a nonprofit that began during the pandemic, taking struggling restaurants and pairing them with meal orders donated to first responders. Off Their Plate currently operates in 9 cities across the U.S., from New York City to San Francisco.
We purchase meals at $10 a meal from our restaurant partners. Half of the cost of each meal goes directly to wages.
That, in turn, allows restaurants like Emily's to hire back furloughed workers.
We normally have 67. And then when this first happened, we dropped down to around 15, but now we're back up to 26.
The orders coming in through Off Their Plate also allowed Emily's to keep providing health insurance to all its workers, even those they still haven't been able to hire back. It's all possible because of donations from corporations and individuals who've given more than $4 million to the cause and restored more than 4,000 restaurant worker shifts.
We're really excited about giving people some source of income through this pandemic.
But Off Their Plate believes that ideally their nonprofit won't be around forever.
The hope is that the restaurant industry and the healthcare workers industry really gets back to a normal where we're not needed.
A normalcy Chef Kevin Tien is aiming for, to get every employee back.
Even if it's one at a time and it takes a little bit longer, but we want to be back.
In Washington, D.C., I'm Maya Rodriguez reporting.
A group of seniors is making face shields for others in need. Why some of the volunteers say they're inspired to keep donating their time.
Keller and Keller, right now.
Welcome back. We like to end the rundown with stories that remind us of the good going on. Today, it's the group of seniors in Florida who are making PPE to keep others safe. They're part of a nonprofit called Handling the Future. It's been making 3D printed prosthetic hands since 2015 and shifted to making face shields and ear guards once the pandemic started. Volunteers say the work is rewarding.
I was always a person of service. You know, I taught special ed. I retired not quite knowing what I was getting into, and then to find a bunch of service-minded people trying to make a difference, you know, that's just in line with my whole life's work.
And just seeing how appreciative the people that received our products were, it makes your day.
So far, the group has produced and delivered more than 1,000 shields and 400 ear guards for free. Well, that's all the time we have today for Coronavirus, The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.